prostate cancer is a malignant transformation of normal prostate gland cells that leads to abnormal and rapid growth of those cells. Most patients with prostate cancer do not have any symptoms at all. Symptoms usually do not occur until advanced stages of the disease and are usually related to the spread of the cancer to other locations. Patients can experience an inability to urinate or passing large amounts of blood in the urine. You can have kidney failure from enlarged lymph nodes that block the kidneys. And you can have back pain from fractures and cancer spread to the bone. African American men and patients with a family history of prostate cancer are at higher risk of getting prostate cancer themselves than the general population. All men, however, are at risk for prostate cancer, particularly those older than 50. Prostate cancer screening is recommended with a digital rectal exam called a DRE and a blood test called a PSA, which stands for prostate-specific antigen. PSA is a protein released by the prostate and can be elevated for a variety of conditions, the most concerning being prostate cancer. Recommended screening protocols differ based on age, race, family history, and other chronic illnesses, and prior DRE and PSA values. Recommendations are ever-changing, making a discussion with a urologist very helpful and informative. If a patient has an abnormal DRE or an elevated PSA blood test, a prostate biopsy is usually recommended for diagnosis. The good news is that prostate cancer often grows slowly. If you are determined to be low risk, treatment may not even be necessary. For higher volume cancers or more aggressive prostate cancers, treatment is usually recommended. The main treatments for prostate cancer include external beam radiation and surgery to remove the prostate, also called radical prostatectomy. 90% of radical prostatectomies in the United States are now being done minimally invasively with a robotic surgical system. Robotic surgery allows for less blood loss, more precise surgical dissection, and the shorter hospital stay with faster recovery. Prostate cancer screening has decreased the risk of dying from prostate cancer by at least 25%. Most prostate cancers are now found while still contained within the prostate before it has had time to spread. Early diagnosis and treatment, when necessary, can effectively prevent the spread of disease. The physicians of North Shore Urological Associates are well versed in prostate cancer management, including robotic-assisted surgery. I've been trained by some of the world's leaders in urologic oncology and robotic surgery at Washington University in St. Louis. I'm excited to have returned home with the knowledge base and skill set to serve the good people of South Louisiana.